So I'm just going to share some experience that we've had fostering some of these components of One Health. I think part of what I think we're hearing today in this session, but what we should continually think about is how do we do it better? What's working and not working about multi-sectoral One Health approaches? Because this in some ways is a big experiment. We historically have not been very good at it. And so how can we continually evaluate ourselves and understand how we can improve? This just is out of a paper that was just published as part of the OIE technical review that came out a few weeks ago. And this was a collaboration between ourselves, CDC, USDA, FAO, OIE, and WHO. And what we realized in developing this paper was there are many One Health tools available to countries, but that there's not always coherence in how we collaborate among ourselves in implementing those tools. So that collaboration has to occur at many levels. And so just to explain this figure a little, these are all the tools, right? IHR self-assessment, PVS assessment, the joint external evaluation, the National Bridging Workshop that is a collaboration between OIE and WHO, the zoonotic disease prioritization tool that the CDC runs, and FAO tools that are involved in laboratory assessments, for example. All of these can collaborate, and so this was sort of a recommendations document of how can a country use these tools effectively to have a very, very strong national action plan for health security and ultimately implement the tripartite zoonotic disease guide effectively. And so a lot of our contribution to this, in addition to sort of facilitating the conversation, was around this tool right here, which is the One Health Systems Mapping and Analysis Resource Toolkit. This is a toolkit that's specifically about strengthening operations for multi-sectoral coordination and collaboration. So it's a 6-step process that basically you do stakeholder mapping, you do interviewing, and then you use process mapping to look at how agencies interact and collaborate. And then the multiple agencies who build this map together, it's a facilitation, then analyze their own system, identify ways of improving it, and develop an agreed-to action plan across agencies. This is this process mapping that I described. This is the avian influenza response that in Minnesota that earlier figure was about. This is basically each of these swim lanes represents a different agency. So all these different agencies sat together and created this map of how they interacted around the response. And then you'll see little stars here. Those represent areas where they felt it wasn't working well, or there was confusion, or they disagreed. They then take those and decide together how to improve that, what they should do, and develop an action plan. So you end up with this basically very detailed action plan of how to improve the multi-sectoral system. So we've used this tool in 18 countries now and 30 US states for a variety of reasons. AMR National Action Planning in Asia, One Health Implementation Planning, a lot of zoonotic disease work. We've also used it for after action reviews, and some of our trainees have used it when they've been in the middle of an outbreak to try and help understand how to improve. And what we see as we implement this tool across the globe is that no one is doing this perfectly. That collaboration and coordination, and what's interesting is as people walk in the door of using this tool, they think, we're doing it great. I know exactly what's going on. I don't even know why I'm here. We know our system. But as soon as they start mapping the system, they realize they're really good at their own swim lane. They can tell everything that goes on in that swim lane. But as soon as they get off, they get confused. I'm not sure what that group is doing. I'm not sure who they talk to. I'm not sure what's going on with this other group that I thought was in, but I don't really know what they're doing. So no one knows the whole system. There's wide-scale gaps, particularly in communication and coordination. That there's a lack of awareness regarding the complexity of the system, and particularly in how, and sort of lack of coordination in communication among agencies and with the public. So there's always limited infrastructure, and particularly around data sharing is always challenging. That policy and regulatory framework is often needs strengthening, and in fact, most of the interactions we see on these maps and in these interactions are ad hoc. So they are relying pretty much on existing relationships and would disappear if people left. So how do we strengthen those relationships and those systems? So the other hat of this system that we've worked on has been the One Health workforce. So obviously with OSEA, there's many people in this room that have been on the ground working on strengthening the workforce for One Health, and there are many lessons learned. You're going to be hearing many of them in this meeting, so I'm not going to reiterate everything we've done for sure. But what we've found is that in order to create that strong worker, that individual factor that will support that collaborative approach, we need a worker that is technically competent, that knows how to be the sector-specific person they are. They're a public health worker, they're a veterinarian, but they also have skills to collaborate effectively across different agencies, and their organization supports them to do so. So their organizational factors are also in place. This has been an enormous effort. We have 84 universities involved, and all the work, complete, I'm very thankful for all the work that our networks have done, and really they have been our implementing partners, so they deserve all the accolades. The One Health Central and Eastern Africa, and here in Africa, and then Southeast Asia, we've had the Southeast Asian networks. And the core to this is that universities play a very important role. That universities are change makers and can be very, very important to meeting these international goals, to strengthening One Health systems in their countries. And so I think we have actually quite a lot of data that shows that this has been effective, that universities are very important players in this system. So we've basically focused on training students, both in universities and in the government, through university programs to strengthen their ability to work in multi-sectoral systems. We've done a lot of field-based training, and we've also strengthened institutions. So universities themselves actually need that organizational facilitation and capacity. So as we look at these conditions, I don't think this is the whole story. I think we're building that story as we speak and in the meetings that we have in this conference of what are the critical factors and how do we effectively create One Health systems and implement One Health work. And we all have lessons learned to share, and so I look forward to hearing them from you. Thank you.